the title for my presentation is Parent Management Training and Emotional Coaching for Oppositional Defiant Disorder. So just to move on to a brief introduction, my client's name was Jeff Reed. He's a 5-year-old Caucasian boy. His history includes multiple medical interventions for a gastrointestinal condition and hearing difficulties, but has no prior experiences with psychiatric treatment. And until about 6 months ago, he was without hearing aids, so had a tough time hearing, and resulted in him being unable to speak in full and complete sentences. But then until recently, he was able to get hearing aids and so was able to speak in full, complete sentences. So the presenting problems, there's a couple. Mostly just externalizing problems, and these problems were starting to impair his ability to function at home and school. Some of these symptoms include frequent tantrums, physical aggression, noncompliance, frustration, and transitional difficulties. So just looking at the family background and a little bit of the environment. So he lives with his parents. Both parents are still together, and his 1-year-old little sister. The family has moved quite a bit due to the father's work. So they moved 4 times since Jeff has been born, so almost once every year. Um, while there was no like significant trauma, the parents did report the loss of 3 grandparents, and this has also resulted in a little bit of the moves to be closer to family. The family's main concerns were just trying to look for more effective parenting strategies to kind of help manage just externalizing and problematic behaviors. They were hoping to just kind of help Jeff transition better and manage his tantrums and emotions better. So moving on to some of the assessment tools that I used. Um, the initial one I used was the BAS-3, so the Behavioral Assessment System for Children. In this assessment, I really like it because it offers empirically based comprehensive information. So it also tells about Jeff's severity and can aid in the development of appropriate interventions. It also helps identify specific subareas such as external problems and adaptive skills, and these can also be really helpful for um, adding later interventions later on, as well as identifying just the severity of the problems as well. Another assessment I used was the Iberg Child Behavior Inventory. This assessment, it's about 36 items, so pretty brief, and it identifies the perceived perception from the parent's point of view of the child's disruptive behaviors. And this one's really good because it really specifies both the intensity and the frequency of the behavioral problems. So with both these tools, I was just kind of trying to really get like a firm understanding of how intense these problems were, how often they took place, and how disruptive they were for the parents. Because you see some cases where the child maybe is expressing really disruptive behavior, but the parents are okay with it. And then you see other cases on the other spectrum where maybe this behavior isn't as bad, but the parents are really seeing it as something that's detrimental and really tough to cope with. So I like the combination of both these tools together. Lastly, I implemented the Strengths and Difficulties questionnaire, also known as the SDQ. This questionnaire was administered to Jeff's parents. And this questionnaire is brief. It's also really flexible, and it allows for strengths and difficulties associated with neuropsychiatric disorders. So it kind of helps identify which are some possible disorders that Jeff could be experiencing, and it examines both the emotional and behavioral strengths and difficulties that are related. So altogether, I was just really trying to get a holistic assessment process, taking in all of these assessments to kind of identify and assist in the treatment planning and support for Jeff's treatment outcome and just his overall well-being as we move forward into the conceptualization and the next process, which is treatment planning. So moving on to the diagnostic conceptualization, listed below are some of the possible diagnoses, but before that, I'd just like to kind of lay my thoughts out on kind of what are the problems that are leading towards these diagnoses, and kind of integrating all this information so we can get a comprehensive understanding of Jeff's behavior and emotional functioning. So, kind of helping to connect Jeff's symptoms to his experience. Jeff's primary symptoms, which were tantrums, physical aggression, and yelling. And one likely possibility for these symptoms may stem from early communication difficulties due to Jeff's impaired hearing. I mean, it wasn't until just a couple months ago that Jeff was able to speak in full sentences. So these difficulties could have very well caused significant language delays and prevented Jeff from accurately expressing his needs. Through these difficulties, it could have very well have led to frustration and externalizing behaviors. So, just for example, when Jeff is maybe trying to express himself and it feels like he's unable to, this could very well likely result in physically acting out, yelling, tantrums, and all kinds of other externalizing behaviors when communication is ineffective. Like I mentioned earlier, Jeff has also undergone quite a few medical interventions due to his gastrointestinal condition that he was born with at birth. This condition could very well cause frustration and discomfort, and this could definitely trigger or even exacerbate some of Jeff's current symptoms. So this is something that I'd like to look a little bit more into, maybe have a complete and comprehensive medical evaluation just to see if there's any further medical issues that need to be brought forth before going into the psychological treatment for this client. Then yeah, of course, just Jeff's frequent moves. I mean, moving 4 times throughout one person's life is a lot, but never mind in 5 years. So these frequent moves and frequent changes could be very frustrating and lead to difficulties properly expressing and regulating his behavior, adapting to new situations, and so forth. While these are just some hypotheses, it's definitely good to lay those out there just to have a kind of general idea of how his symptoms are connected to his experience. But yeah, moving on to kind of the diagnostic ideas that I had. I'd like to start with the primary diagnosis, which is going to be oppositional defiant disorder. So this is a pretty common one in youngsters, especially around Jeff's age. And this is typically characterized by a persistent pattern of angry or irritable mood and argumentative or defiant behavior. And I also I label this as about a moderate severity due to Jeff having these symptoms in both his school and home. I was unaware if there was other settings at the time, but just with these 2 settings in place, it likely reaches the moderate severity. Looking at the secondary diagnosis, I would probably suggest an adjustment disorder with disruptance of conduct. And this is typically characterized by emotional and behavioral symptoms and responses to stressors. And these stressors, I would like to say probably the death of his grandparents, which was 3 in the last couple of years. That's obviously pretty traumatic. Even though the family just declined to say there were traumatic experiences, it's tough to really say for sure what the child is experiencing and how significant it is for them. And then the frequent moves as well. Those can be especially challenging for young kids. Then the specificity of the disruptance of conduct is due to the predominance of the conduct-related disturbances in regard to the stressors. Um, Now these are just the primary and secondary, but there's a couple other differential diagnoses I'd like to lay out there, which I thought were pretty important as well. So ADHD, combined presentation. Well, it's tough to say for sure what's leading to these impulsive and argumentative behaviors. Some of the common symptoms of ADHD look pretty similar to ODD, so that's something I'd really like to look into further and have some further assessments to kind of judge and see how he relates to some of the ADHD criteria. Disruptive mood dysregulation disorder is also a pretty common one. Then looking at generalized anxiety disorder, actually, it's tough to say exactly where these externalizing behaviors are coming from, and not knowing what's going on in the inside can be difficult. So, just further assessing and seeing how Jeff is feeling, and maybe some of this anxious feelings is being expressed outwardly into these externalizing behaviors. So, I would like to further investigate the symptoms of that and the diagnostic procedure for that as well. So yeah, now moving forward, I'd like to talk about the treatment goals. There was a couple treatment goals I had for Jeff, but the primary goal that I'd have for him is just to reduce both the frequency and intensity of his negative behaviors. So this was the tantrums, the aggression, the yelling, all that kind of stuff. And the parents, as of currently, they said that Jeff was these behaviors were occurring quite frequently, about 3 to 4 times per week, and sometimes multiple days. So within 3 months, I would say it's pretty reasonable to try to reduce these behaviors to 1 day per week, within, yeah, the 3 month time period. And then as a secondary goal, the parents stated that he was quite non-compliant most of the times. I think he was non-compliant about 50 to 75% of the time. So that means he was only compliant about 50 to 25% of the time. So I'd like to really try to increase this up to 80% within 3 months. So this is looking like responding to his parents' request to pick up toys or go to school or get dressed, which as of right now he's not doing most days and most times. So to try to reach these goals, there's a couple interventions I'd like to put in place. But the first and the primary intervention for this is it kind of falls under the lines of um of parent um implemented teaching, and this is going to be the Webster Stratton's Incredible Year program. Now, I really like this program because it's highly structured and it allows for several specific interventions to be placed during multiple phases of treatment. This treatment typically begins with a educational phase where parents are provided with video vignettes about how to model for parenting skills, kind of have an idea. These vignettes also demonstrate appropriate child development and what to look for their child. Then these interventions also help with the child. They help him to learn effective strategies for responding to his tantrums, his physical aggression, his yelling behavior. And these are both implemented through the parent, through teaching, and then also through the child component, and where group sessions with other children facing similar problems are also able to go through. And one of the main components of the child component is the use of puppets for demonstration engagement. And I really like this because it's engaging and it's fun, and it can help Jeff understand that it's being compliant and doing these things doesn't have to be a complete drag. So implementing a fun tool is something that I really liked about this intervention. And the secondary intervention, which is kind of similar to the Webster Stratton, the Incredible Years program, insofar as the parents are the main mediator of the interventions. But this one focuses a little bit more on the emotional side of things. So it helps both the parent and the child learn how to self-regulate and cope with the difficulties related to the child's externalizing behaviors. And then it also helps them recognize and manage emotions. And the other thing I really liked about this was the implementation of a behavior chart. And a behavior chart can be used for both interventions, but it's especially helpful for emotional coaching. And it's useful for both monitoring progress, but then also as a positive reinforcement and a feedback system, and where the child and parents can visually see how progress is being made and kind of along those lines. So just kind of analyzing these interventions, because as we know, most interventions come with both their strengths and difficulties. But yeah, starting with the Incredible Years program, there's a number of potential strengths. It's very well researched. I was visiting the website, and there must have been at least 50 to 100 well researched studies that I could have dove into and spent the whole project looking at. But um, yeah, that's just a side note for now. Um, I really like the parental involvement, which is key to long-term outcomes, in which these parents can keep reinforcing these parent-child interactions, and through improving the parent interaction, this can also really improve the child's behaviors. This program also uses a ton of engaging methods. In addition to the puppets, it also uses role playing and games. This is especially prominent in the child session and the group sessions where the kids can kind of get along together and use role playing and games to kind of help understand how to regulate their emotions and how to effectively communicate with others, and how to deal also when there's upsetting moments and they would kind of feel like they'd rather lash out. Of course, there's a couple of challenges. So this one is a significant time commitment. I think both the parent and the child one were supposed to meet a couple times a week and for a couple hours. And it's also expensive. On the website, I think the average program was a couple $100s. And so for a ton of families, this is not possible. So looking for some other affordable options is definitely um, a must do for some families who aren't fortunate enough to implement such a costly program. And then also, backflash to that one, but just looking at the emotional coaching one for a little bit, I'd like to highlight that I really like the empowering aspect of it, as it really helps the child to effectively learn how to manage their emotions and behaviors, and not so much on the parent teaching the child these behaviors, and the parent having to always be there to make sure that their child's doing what is best needed in terms of the behavior and outcomes. This behavior is also really helpful as it can just reduce the frequency and intensity of the tantrums and displays. And this one again too, since the parent is teaching the child most of the skills, can really help with the parent-child relationship, and this will really help with communication methods and emotional support for the child, so they don't feel like they're alone and they're going through the treatment together with the parent, as the parent is also required to learn some of these skills and everything else like that. um, But yeah, this one again, it can be challenging, especially for parents sometimes to have to undergo these difficult interventions, and where they have to really come to understand their feelings and what it means like to deal with the frustration of their child experiencing all these situations. So it can be helpful for them to kind of take a step back, but also really challenging at the same time. Again, it's a time commitment. All these strategies require time and effort on both the parent and the child. It's not a one and done or anything like that. And then sometimes the child just simply does not want to sit there and take deep breaths and be with their thoughts, be with their emotions. So getting them to comply with this can be difficult. And that's why sometimes it's helpful to use the puppets, the games, and other things as used in the Incredible Years program to kind of implement that and work those in together to have a strong intervention that's also fun and engaging for the child. So yeah, as a conclusion, just to kind of wrap things up here, I think both assessments are good. They are comprehensive, and then yeah, they effectively manage behaviors. There was a ton of research showing how helpful they were. Um, of course, they come with their downsets, but nothing that can't be handled. And I think overall, if the parents kind of come together, which was also said as one of the strengths of Jeff, that a good parent commitment. So I think with that being said, that both these interventions can be really helpful and a good holistic treatment approach to helping him negate some of these behavior challenges. So yeah, that's all, and thank you guys for watching.